Carvedilol, a medication synonymous with the treatment of high blood pressure and heart failure, has been a cornerstone in the management of cardiovascular conditions for decades. Its multifaceted approach in treating various heart-related issues has made it a subject of interest among healthcare professionals and patients alike. This comprehensive exploration aims to demystify carvedilol, delving into its typical uses, advantages, potential adverse effects, dosage guidelines, and dangers, providing insights to those pondering whether carvedilol is the right medication for their condition. Introduction to carvedilol. Carvedilol belongs to a class of drugs known as beta blockers, medications that have been pivotal in the management of cardiovascular diseases. Its mechanism of action is intriguing. By blocking beta-adrenergic receptors in the heart, it reduces the heart rate, myocardial contractility, and the release of renin from the kidneys, culminating in decreased blood pressure and an improved heart function. Additionally, carvedilol possesses antioxidant properties and blocks alpha-1 receptors, which further aids in lowering blood pressure. This dual blockade makes carvedilol distinct from other beta blockers, positioning it as a versatile treatment option in the realm of cardiovascular therapeutics. Typical uses of carvedilol. Carvedilol's primary application is in the management of hypertension, high blood pressure, and heart failure. Its ability to lower high blood pressure helps prevent strokes, heart attacks, and kidney problems, which are often life-threatening conditions associated with hypertension. In patients with heart failure, carvedilol is used to improve survival and reduce the risk of hospitalization. It is also prescribed for patients who have suffered a heart attack that has led to a decrease in the heart's functionality, aiding in the prevention of future heart attacks and improving survival rates. Furthermore, carvedilol is sometimes used off-label for the treatment of other conditions such as arrhythmias and in certain cases of cardiomyopathy, showcasing its versatility as a cardiovascular medication. Advantages of using carvedilol. The benefits of carvedilol extend beyond its primary functions of lowering blood pressure and improving heart failure symptoms. Its unique action of blocking both beta and alpha receptors allows for a more comprehensive management of hypertension, offering an advantage over traditional beta blockers that only target beta receptors. The antioxidant properties of carvedilol also provide added protection to the heart and blood vessels, potentially reducing the progression of atherosclerosis, hardening of the arteries. Moreover, carvedilol has been associated with a lower incidence of diabetes mellitus compared to other beta blockers, which could be particularly beneficial for patients at risk of developing diabetes. The combination of these features makes carvedilol a preferred option in certain patient populations, emphasizing the importance of personalized medicine in cardiovascular care. Potential adverse effects of carvedilol. While carvedilol is beneficial for many patients, it is not devoid of potential adverse effects. Common side effects include dizziness, fatigue, and hypotension, low blood pressure, especially when initiating treatment or adjusting dosages. Some individuals may experience bradycardia, slow heart rate, weight gain, and gastrointestinal symptoms such as diarrhea or nausea. Less commonly, carvedilol can lead to more serious conditions such as worsening heart failure, bronchospasm in patients with asthma or chronic obstructive pulmonary disease, COPD, and changes in lipid profiles. It is crucial for patients to be closely monitored by their healthcare provider when on carvedilol, particularly during the early stages of treatment, to manage any adverse effects effectively. Dosage guidelines for carvedilol. The dosage of carvedilol is highly individualized, determined by the specific condition being treated, the patient's response to the medication, and their tolerance of side effects. For hypertension, treatment typically starts with a low dose, gradually increasing until the desired blood pressure control is achieved. In heart failure, the goal is to titrate to the highest tolerated dose for optimal benefits. It's imperative for patients to adhere to their prescribed dosing regimen and not to alter or discontinue the medication without consulting their healthcare provider. Adjustments in dosage may be necessary based on the patient's clinical response and any side effects experienced. Dangers and precautions associated with carvedilol. There are several precautions to consider before initiating carvedilol therapy. Patients with certain conditions such as asthma, bronchospasm, severe liver disease, or a history of severe allergic reactions may not be suitable candidates for carvedilol due to the risk of exacerbating these conditions. Additionally, caution is advised in patients with diabetes, as carvedilol can mask signs of hypoglycemia, low blood sugar. Pregnant or breastfeeding women should only use carvedilol if absolutely necessary, under the guidance of their healthcare provider. Understanding these dangers and taking appropriate precautions can help mitigate risks associated with carvedilol therapy. Carvedilol compared to other medications for similar conditions. When considering carvedilol in the context of other medications for similar conditions, it's important to recognize its unique properties. Unlike pure beta blockers, carvedilol's dual action of blocking both beta and alpha receptors provides a broader therapeutic effect, potentially offering superior blood pressure control and vascular protection. However, the choice of medication must be tailored to the individual, taking into account their specific condition, comorbidities, and the medication's side effect profile. In some cases, combination therapy involving carvedilol and other antihypertensive agents may be the most effective approach. The decision should always be made in consultation with a healthcare professional, considering the latest clinical guidelines and evidence. How to use carvedilol effectively. For carvedilol to be effective, patients should adhere to the prescribed treatment plan and follow their healthcare provider's recommendations closely. This includes monitoring blood pressure and heart rate regularly, adopting lifestyle changes such as a healthy diet and regular exercise, and avoiding substances that can exacerbate heart conditions, such as alcohol and recreational drugs. Patients should also be aware of potential interactions with other medications they may be taking and report any adverse effects to their healthcare provider promptly. Effective communication and a strong patient-provider relationship are key to optimizing the benefits of carvedilol treatment. Frequently asked questions about carvedilol. What should I do if I miss a dose of carvedilol? If a dose is missed, it should be taken as soon as possible, unless it is almost time for the next dose. In that case, skip the missed dose and continue with the regular dosing schedule. Do not double up doses to make up for the missed one. Can carvedilol be stopped abruptly? Carvedilol should not be stopped abruptly, as this can lead to a worsening of heart conditions. If the decision is made to discontinue carvedilol, it should be done gradually under the guidance of a healthcare provider. How long does it take for carvedilol to work? The effects on blood pressure may be seen within a few days, but it may take several weeks for the full benefits on heart failure symptoms to be realized. It's important to continue taking the medication as prescribed, even if you feel well. Conclusion: is carvedilol the right medication for you? Determining whether carvedilol is the right medication depends on a variety of factors, including the specific condition being treated, individual health status, and how one responds to the medication. While carvedilol offers numerous benefits for patients with certain cardiovascular conditions, it is not suitable for everyone. Engaging in a thorough discussion with your healthcare provider, considering the potential advantages and disadvantages, is crucial in making an informed decision about carvedilol therapy. Ultimately, the goal is to achieve the best possible outcome for each patient, tailoring treatment plans to meet their unique needs and circumstances.